25 minutes before 10 o'clock. Thank you for tuning in. You know, every part of your body is important, and when something goes wrong with any part of it, that's when you say, oh my gosh, I should have taken better care of that. On Saturday at the Strawberry Festival, one of the vendors was giving away toothbrushes. I don't know who it was, and I saw several people actually brushing their teeth after eating, and like right in the ground. It's almost like Woodstock or something. People kind of just out there brushing their teeth. Dr. Simon Amir is our go-to authority when it comes to questions about oral health and teeth care. He's the owner of Grand Oaks Dental Care, not too far from the studios here, over by Publix, right? And he's the dental co-director of the Freedom Clinic, which provides free dental, optical, and medical treatment once a year in Ocala. He volunteers at the Marion County Health Department. He's an advocate for patient comfort and alumni of the University of Florida. He helps local community groups, plays guitar, piano, and drums. He's a one-man band and a dentist. Good morning, doctor. How are you?
Good morning. I'm great.
Good to see you again.
Good to see you, too.
Yeah, I was telling you off the air about a dentist. We had listened to him give a little speech about how he got oral cancer.
Right.
And because he was always conscientious of working closely with people and having bad breath, so he would always use, like you said, alcohol-based mouthwash.
Right.
And that he says, caused him cancer.
Absolutely possible. Yes. Alcohol and mouthwash or alcoholic drinks. Especially combined with smoking. If you both have alcohol exposure to your mouth and smoke cigarettes, they combine in a synergistic way. You get many times the risk of oral cancer. Oral cancer is one of the cancers that doesn't have very high survival rates because it tends to be diagnosed late. It can be very aggressive. We're seeing a lot more oral cancers nowadays related to the HPV virus, which is very widespread.
Is that right?
Almost half the population has some form of HPV virus. Most people don't have any symptoms. It's kind of scary. Those are going up.
Really?
In men.
Really? And I don't know if this is awkward or not. Isn't that a sexual disease?
Yes. Yeah, it tends to be, but it can be sort of more, doesn't have to be all the way, so to speak. It can be sort of more casual contact. We just had a lecture recently by a professor from the Department of Pathology at UF in the dental school, and he was really advocating, as they've been doing for a few years now, to take the HPV vaccine or have your kids get it when they're adolescents, when they're preteens. So it's kind of useless if you take it or get the vaccine in your 20s or later.
Because you've already been exposed to it.
You've already been exposed to it, correct. And there's only certain subtypes that give you some risk, and it's mostly treatable if you get it early enough. It was a pretty eye-opening lecture that we just had recently. So I definitely encourage any parents out there to talk to their doctor about having their kids vaccinated.
So is this something that we could prevent if we had regular visits? Like, would you see it in advance, or do we have to tell you we have a symptom?
It's very tough to screen everybody because most people don't have symptoms. So it's something to definitely look it up online, talk to your doctor about it. We can't screen or test everybody. I'm going back to what he was saying in the lecture, like you'd have to screen a lot of people to even find one, with visible signs. So it's the kind of thing that prevention is best. Prevention is definitely the best strategy. Get your kids
the vaccine. Yeah. Do the non-alcoholic mouthwashes benefit, not just with the papillomavirus, but I mean with anything?
I mean, apparently it's essential oils. At least that's what the mouthwash manufacturers want you to think. The essential oils in the mouthwashes, which help, as well as the alcohol. Alcohol, unfortunately, in mouthwashes tends to dry out your mouth a little bit. It's going to give you very temporary relief of any kind of bad breath symptoms. Usually, getting rid of the underlying cause with breath is better than just trying to hide it with mouthwash. And that that underlying cause, it may be bacteria from your tongue, maybe stuff related to your tonsils, it may be gum disease, it may be cavities. There's many different reasons you can get get breath problems. So
How often do you recommend people come in for a cleaning?
it depends. It depends. I've seen some patients before who they skip a couple of years between cleanings, and they come in and it looks like they had a cleaning last week. I mean, there is no buildup
Because they
whatsoever.
brush their teeth a lot? And
There's
they don't drink
there's
coffee?
a lot of factors to it. There's a lot of factors. Just some people's body chemistry, their genetics, they just don't get that tartar
Is that
buildup.
right?
The main
All right.
reason, there's a couple of reasons you get cleanings. One is, okay, you have stains that are unsightly on your teeth, and you don't like how they look, and you can't get it off with your toothbrush, so you go to the dentist, they clean it off. That's very nice. Those stains are, not nice to look at, but they don't particularly cause any healthy, like health type of problems with your
really?
teeth. It's the harder buildup on your teeth that needs to be sort of like scraped off, by the dentist or scaled off. That causes more problems now, and different people build up different amounts. It's not necessarily related to how well they take care of their teeth. There is a lot of relationship between kind of what you eat and your overall health, which is a little bit of what we'll get into today. But, basically some people need to get their teeth cleaned every 3 months if they have more severe gum diseases. But most people can do it every 6 months.
Okay, you mentioned what we eat. So explain what you mean by that. The foods we eat contribute to our health or take away from the health, or?
Yeah. Well, specifically, as far as like your need for cleanings. Now, you need cleanings more if you get more tartar buildup. Tartar is that hard stuff, again, that you can't get off your gums. It grows above and below your gums. Well, tartar starts out as plaque, which is the soft stuff that you can take a fingernail and,
Oh, okay.
see that white stuff there?
Okay.
It only goes from the soft to the hard once it's sat on your teeth for a while.
Oh, no.
And combined with minerals in your saliva.
Yeah.
Right, it's kind of like scale on a drain.
Ooh.
That needs to be scraped off professionally. But anyway, you get more plaque buildup if you eat more foods which contain refined carbohydrates. Okay. Refined carbohydrates, fancy word for flour, sugar. Flour and sugar, basically.
Yeah.
That white stuff that you see on your fingernail when you scrape your teeth.
I've never actually done that. I don't.
Yeah, well,
I'm dying to scrape my teeth. I don't know.
okay.
I've never done that.
Well, try it. You can try it, and if you haven't brushed your teeth all day and had a couple of meals, you'll see something on your fingernail.
Okay.
And that's basically millions or billions of bacteria swimming in a sea of sugars.
Oh, that's
And
not good.
they are digesting those sugars as they sit there and excreting acid onto your teeth. Okay, and that's kind of what causes tooth decay.
Wow, that's crazy.
And so the more refined carbohydrates will cause more plaque buildup and more tartar buildup.
When a person needs to have braces and they don't have the plate ones, but they have each thing that's attached to each individual
Right, those
tooth.
brackets.
Once the brackets are removed, does that make the tooth enamel deteriorate, and do you have to build up again?
No, but if you think about it, when you have those brackets on your teeth, you have an area which is kind of harder to clean. It's easy for food to get stuck in there.
Yes,
So,
right.
we see that with kids a lot. Sometimes kids aren't particularly motivated to brush their teeth, and of course they're the ones getting braces most of the time.
Sure.
We'll sometimes see when we take the brackets off, well, geez, there's like a chalky white circle on their teeth. In extreme cases, sometimes they've gotten a cavity there, but it's usually because that diet high in refined carbohydrates combined with not brushing effectively enough.
Oh, okay.
Thankfully, when people have braces, they usually see the orthodontist a lot, and they'll point out to them, hey, I've seen cases where if the kid is not being compliant, the orthodontist will make them take the braces off if they're not taking care of it. So we see less of that nowadays.
So your statement about the carbohydrates kind of plays to, or suggests that everything we've heard all of our lives is true, for one. I mean, a lot of times we hear things all of our lives and it turns out it's not true. But all my life I've heard, don't be eating sweets, you're going to get cavities.
Right, absolutely.
So apparently there's some
100%
truth
true.
to that.
Yes, but it's slightly more complicated than that. There's some people I know Actually, some people I work with that can have all the sugar that they want, never had a cavity their whole life. You know, there's
Isn't that interesting?
both the environmental, like what you put in your mouth factors, and a lot of genetic factors that go along with that too. You need to have that type of bacteria sort of dominating in your mouth to some level to cause cavities. There's only certain types of bacteria which contribute to cavities. So if you don't have them, you're not going to get cavities.
Right.
You must have, you come from a dad who was a dentist.
Yeah, still is a dentist.
You have a twin brother that's a dentist. And overall, these years, his generation and your generation, you must have seen a lot of changes as to a good oral health.
Yeah, absolutely. Like, dental decay has been going down for sure. Part of that is related to mass fluoridation, which, fluoride hardens the surface of your teeth, makes you less likely for them to break down and get cavities in the first place. But we see sort of different problems. The population is aging. There's more people that live longer now, and they tend to get different problems with their teeth. Sometimes obviously worse. They tend to have more advanced gum disease. If you've had a fair bit of gum disease and have trouble now, if you're in your 80s or 90s and you can't quite brush the way you used to, you've exposed parts of your teeth from that gum disease that are very much less resistant to decay. The roots of your teeth are not protected by enamel. They get cavities much more easily.
Oh my gosh.
When
Oh,
people-
that's not good.
Yeah, when people are young, like kids, they tend to get cavities on the chewing surfaces of their teeth. As you get older, we see it's much more prevalent to get cavities at the gum lines.
When somebody has the sensation, the uncomfortable sensation for hot or cold food or drinks, what would you suggest that they do?
First of all, if you're having any kind of sensitivity whatsoever, it usually means there's something wrong.
It's a cavity usually.
It's worth getting checked out. I see my beautiful pregnant wife walking by. She's
gorgeous.
36 weeks pregnant. Yeah. So.
Is this your first child? Or?
Second child? Yeah.
Second child. Oh my.
We're very excited to be having a girl. But anyway, back to what we were saying. That sensitivity may be completely benign. One thing you could try if you're not ready to go to the dentist yet is try using a sensitive toothpaste like Sensodyne for a few weeks.
Yeah,
okay. If it doesn't go away, then you have some more problems. Cold sensitivity, sometimes just from brushing too hard, you can get sensitivity.
Okay.
Hot sensitivity is usually slightly worse. There's more going on. Sweet sensitivity tends to almost always mean a deep cavity.
Oh, really?
Yeah.
Oh, that's interesting.
And the next phase after you get that, especially the hot and the sweet sensitivity, it's usually going to turn into a toothache sometime.
When something is going on in your mouth, does that affect the different parts of the body overall?
Absolutely, and in many different ways. There's a lot of relationships that we know of. With more advanced gum disease, and when I say gum disease, I mean specifically the gum disease called periodontitis. That's as opposed to gingivitis, which is more mild gum disease. But periodontitis is related to a whole bunch of different diseases in the body. Diabetics are more likely to get periodontal disease.
Really?
And having periodontal disease as a diabetic makes it harder to control your blood sugar.
Really?
Yeah, you have a higher risk of heart disease. You have a higher risk of stroke. You have men with pancreatic cancer, 51% more likely to have periodontal disease. Men with kidney cancer, 47% more likely.
Wow. That's
Blood
amazing.
cancers, 30% more likely. Now, that doesn't mean that necessarily gum disease causes those other diseases. They see them together.
Is it the other way around?
There's a correlation. Now, proving that one thing, A causes B, rather than A is associated with B in some way, is much harder to prove. And they're doing those studies now. They're basically starting to study, well, hey, if we treat this periodontal disease, does that actually lower
Yeah,
those other
yeah.
diseases? And that's, I think we'll have better answers to that in a few years. But another thing that happens a lot, that we see happen a lot, is even pregnant women, like my wife, higher chance of preterm and low birth weight babies if they have periodontal disease.
Wow. So it's all associated with everything, then.
All kinds of things. And they used to think it was specifically related to the bacteria. Now they're thinking it's more just the chronic inflammation in the body. So a lot of these diseases have inflammatory aspects to them.
Really?
And when you have gum disease, you have chronic inflammation in your mouth. Your immune system is reacting against itself. That's what causes a lot of the damage from the gum disease. That particular gum disease, periodontitis, causes you to lose gum tissue and lose the bone that's keeping your teeth attached to your head, as I like to say to my patients. But that same inflammation has a component in many of these other diseases.
Speaking of the bone that keeps your teeth attached to your head, the implants that we always see advertisements for, that's obviously screwing into that same bone.
Correct.
Talk about that a little bit. How has that changed since it started? Is it healthy? Is it smart to get more than one? I've seen ads that say you can do your whole mouth.
You can absolutely do your whole mouth with implants. It's expensive to do so when things are that bad, but when as long as you're relatively healthy overall, you can do very well with implants. If you have a history of that severe gum disease, you have some higher risk with implants as well.
I gotcha. Okay. And is the lower jaw more easy to work with than the upper
Correct.
teeth?
Yeah.
Okay.
The bone in your lower jaw is more dense. So generally, on average, you have higher success rates. Implant success rates are very high nowadays. The technology is always changing and getting better and better and better. So, you can, if you have an evaluation by someone that knows what they're doing, they can give you a very good idea of would those implants work for you.
Grand Oaks Dental is a family-oriented dental, so you
Correct.
care for everyone in the family. When a new client comes in, a new patient, do they have a lot of paperwork to fill out so you know what kind of history they have?
Yeah, absolutely. I mean, we'll oftentimes have patients fill out their paperwork online beforehand. They can just do that on the computer. That way they come in and we already know those kind of things about them. If they don't do it beforehand, we have iPads that they just fill things out on right there. And
Oh, nice.
yeah, so we get a thorough medical history, a dental history. We want to know what brought them to where they are now. One of the first things that starts, turning the wheel in my head when I see somebody and I see how their mouth is doing, I think, what brought them to this place and what can we change for them to stop this happening in the future?
Lifestyle-wise, you mean?
Yeah. Well, a combination of things. It's not that, no, you have to do everything. No, we have tools at our disposal to help you, but we'll gently nudge you in the right direction. Sometimes just being consciously aware of how how you've had these problems in the past is enough to sort of get you to notice your own patterns more. A lot of people come to me and I ask them that question, like, do you know how you've gotten these cavities? And the answer is no. I mean, you mentioned sugar, that everyone's been telling you your whole life.
Sure.
A lot of people haven't heard that message. So
Yeah.
just knowing I will say that it's hard to change. Old habits die hard, right? But there's
Old habits do die hard. Yeah.
But sometimes it's just a case of making it easy. So it's easy to start using an electric toothbrush, for instance, if you just throw away all your manual toothbrushes and then you only
Is that a good idea to use the electric one?
If you're having trouble with, if you're not brushing your teeth well with a manual toothbrush.
How do we know? How do we know if we're doing it well or not?
You have your friendly dental professional to help you.
You tell me, right?
Yeah. So we can see much easier than you can, if there's still plaque left over. Okay. Now, I always thought growing up, the reason I'm brushing my teeth is just so my breath doesn't stink, right?
Right.
But really,
It's more than that.
yeah, you're trying to get that bacteria cleaned off your teeth.
Is that bacteria what actually smells? Is that what the stink comes from?
Yeah, like I said before, it can be it's almost always bacteria, but it just depends where they are. There's several different places that can cause the bad breath. But you're trying, when you're brushing and flossing your teeth, you're trying to get those bacteria off your teeth before they start producing acid. It takes them about a day to start producing acid.
Oh, good.
They have to sit there and hang out.
Well, I'm a 2-time-a-day toothbrusher, so I'm getting them.
Got it. Yeah.
You know what? I always buy toothpaste that has stannous fluoride in it, and the other one is called sodium fluoride, right?
yeah.
What is the difference? Is there any?
Stannous fluoride is usually something that's used for more severe cases of tooth decay. It does have the effect of staining your teeth to some level. So if we have patients with a lot of sensitivity or high decay risk, we'll give them stannous fluoride sometimes. There's even stannous fluoride rinses. But sodium fluoride is enough for
That's
most
good
people.
enough. That's good
Yeah.
enough.
Yeah.
You also give back a lot to the community. You're the co-director, the dental co-director of the Freedom Clinic, and you provide free dental
Correct.
to our community. So that's really to be commended.
Thank you. Yeah, I appreciate that. It's been a lot of fun doing it. We've started doing these clinics every month now. So we take one Saturday a month and usually see around 120 people.
Wow. Oh, wow. That's amazing.
Yeah, and we do it we've collaborated with the University of Florida College of Dentistry, and we get about 30 dental students every time to come do it. And they actually do a lot of the work, and we look over them and help them out. And it's really fun teaching.
I bet it is.
It's a good time, and you see the same faces, the same kids who are so motivated, and I can tell, wow, those guys are going to do really well. It's been a very nice thing, and then of course the community, the people that we go and help are very appreciative. A lot of them camp out.
Oh,
before.
yeah, the lines are very long.
Yep. So. You know,
Dental insurance is kind of a whole different subject, isn't it? I know people who have dental insurance and they are not really happy with what it pays for. It's almost like it's pointless to pay the insurance company.
You know, with dental insurance, I think you do get what you pay for. I mean, if you need dental work and you're willing to go and get it, it's worth having dental insurance. Do shop around, but they're only going to pay for so much per year. You know, if you have a multitude of problems, it's going to run out quick. But most of the insurance plans are also going to negotiate with the dentists lower fees. So you can see it as almost a discount plan. Even if they stop paying out some, you're still going to end up paying less out of your pocket. Although compared to health insurance, you know, you're paying a higher percentage out of pocket, but you're also not paying, you know, $500 a month or more for dental insurance.
Do you know, I this is maybe going to ruffle some feathers, and hope I don't make anybody upset with me. And this goes back a long, long time. I moved to Florida when I was 17. I'm 63 now, so it's a very long time ago. But I can remember seeing somebody with no teeth, and he wasn't that much older than me. And I said, "What happened? I mean, where'd your teeth go?" Because he had teeth. And the dentist pulled them. They were all bad. I said, you know, in New York, they never would have pulled them. They would have filled them. They would have done something.
Right.
And now I don't know this. So this is, we're talking 40-something years ago.
Yeah.
So it's, but I don't see it that much anymore. I don't see like pulling teeth as the solution to a problem as much anymore as it once was.
Yeah, I think that in previous generations that was definitely much more common. I have unfortunately had to do dentures on very young people before. Sometimes a tooth gets way too far along and you can't do anything. You know, when teeth have severe problems, they're expensive to fix. Some people can't afford it. But you get to a certain point where no matter what you do, it's not going to work, you know, so.
Well, if your demeanor is any indication of what your practice is like, it's got to be gentle. I mean, you got such a gentle demeanor, doctor.
Yeah, thank you. I appreciate
Dr.
it.
Simon Amir is who we're talking to. He is visiting us from Grand Oaks Dental Care over by the Publix, which is right across from Trinity Catholic High School.
That's correct.
I suppose you're between the Publix and the Italian restaurant, right? Somewhere over there?
Yes.
Somewhere over there?
We
Okay.
have good food choices there.
Anything else we want? Sorry. Anything else we want to mention? With the address, obviously, is 2575 Southwest 42nd Street, Suite 104, if you're looking it up. And your phone number?
Phone number is 352-877-4926.
Okay. Thank you for coming in, Doctor. It's such an important topic, and you do such an amazing thing. And
Yeah, thank you for having me. Appreciate it.
next time we'll have to use your own music as intro
Okay.
and outro music.
Sounds good.
Thank you, Doctor. We'll be right back.
Broadcasting from the Paddock Mall Studios, this is WOCA, Ocala, Gainesville, The Villages, 1370 AM, 96.3 FM, The Source.
Here is your news brief from the source. WOCA. Florida's Healthy Start program is facing huge budget cuts from the state Senate. The program helps thousands of high-risk mothers and babies in Florida. The state Senate has proposed $19 million in cuts. Officials with Healthy Start say that is 29% of its budget. Senator Marco Rubio spelled out his plan released this week for curbing gun violence during a stop in Tampa on Saturday. Rubio said his plan has several components, including strengthening